Absolutely, yeah. So I treat cancer patients in my clinic every week, and I see, unfortunately, people are waiting for scans and test results, and they're waiting for their treatment. And I think when you think you might have cancer, or when you've got cancer and are waiting for treatment, any delay is obviously really worrying for patients.
And in terms of addressing those issues, what's the key from your perspective? Is it staff numbers? Is it general funding? Is there something else driving this?
I think the key is absolutely staff numbers. So we know that for years before the pandemic, but made worse by it, we don't have enough staff in key areas in the NHS. And what we're really calling for is a fully funded NHS long-term workforce plan so that we can get the doctors and nurses and other staff that we need to be able to give patients the right access and the right treatment in the right time.
We're going to put some of our viewers' comments to you in a moment, but I'm also aware that there'll be many people watching this who are maybe worried about either themselves or a family member and concerned about potentially cancer treatment. And you're an oncologist, so is there anything you can do to... I'm not asking you to give us anything that's not true, but what about reassurance of the quality of cancer care that we do have in this country?
Absolutely. I think, first of all, every doctor and nurse and radiographer that you see is doing their very best to give you the best treatment. We're in this job to help patients, and we will continue to do that and to support you through the uncertainties of this. I think there's many things that the UK does fantastically well in cancer. 1 in 10 of our cancer patients go into clinical trials. We have a fantastic research basis in this country, and patients can benefit from state-of-the-art treatments. And we're pretty good at getting new radiotherapy techniques, new surgical techniques, and new drugs into practice. But I guess part of my worry is that without the staff to do that, we're going to fall further behind, and we won't see the advances that these new treatments can bring us being put into use for patients.
OK, it's a very balanced opinion, Dr Rokes. I know Tessa's been getting loads of comments from our viewers tonight as well. Could probably bring some of those into the discussion.
Yeah, and it's quite a mixed picture, actually. We heard from Rashmi in London, first of all, who says, I'm a disabled person. I've been waiting for hospital treatment since 2020. They definitely need to do something. Jane in Norwich says, I visited A&E in Norwich recently. I was in and out in just over 2 hours. The staff were great. And then a number of people saying, I had to wait 12 hours in A&E, but the staff were brilliant. Rachel from Widnes says, I'm on a waiting list for treatment for my brain. It's just horrible. I'm in such pain. But Lisa from Northamptonshire goes back to the staff again, and she said, I've had to go to A&E and I've had amazing service. I wonder if you could talk a little bit about how staff are feeling during all this. It must put tremendous pressure on you.
That's right. I mean, we want to provide the very best care we can for every patient we see. That's why we go into these professions, undoubtedly. And so we feel that pain too. We empathise with what patients are going through, and many of us are patients ourselves, and also see these waits. I think I'm also very proud of the approach that staff are taking. We are working as hard as we can to get patients through the system as quickly as possible, and that goes for ambulance staff, A&E staff, GPs, the whole NHS staff.
Do you feel that you're... don't take this the wrong way. You're banging your head against a brick wall. Do you feel that there's a way out of this?
Yeah, there are ways out of it. So in cancer care, we have more trainees coming into cancer medicine at the start, and they will turn into more consultants in the future. But we need that funding to increase. We're working hard to find ways to support staff in small ways. I mean, you hear stories of junior doctors not being able to get hot food on time or having difficult rotas, and there are lots of relatively simple IT system things that you could change to make sure that doctors are not having to type their own letters or put their passwords in hundreds of times every day. So there are some short things that people could do to improve care for patients and to improve the working lives of staff. But I think we really, really need that fully funded workforce plan. We need investment in medical schools, in doctors, in ways to avoid doctors retiring early. And once we've got that, then we'll start to tackle this problem.
We really appreciate your expertise. Thank you very much for talking to us tonight. That's oncologist Dr Tom Rokes.